think we're live. Let me just double check. I think we're live. Are we audible? I'm going to second, guys. Yes, we are. Yes, we are. Okay. Welcome, everybody. Hi, I'm Dr. Sylvia. Welcome to my live. I think we have got things in really good format today, I hope. But we're going to do a quick live stream just to check that I'm getting used to this new kind of streaming functionality. We're talking about fallopian tube blockage, and I've got a few questions around the subject. And of course, if you've got any new ones, feel free to pop them in the chat section for us to talk about today. But welcome. Where are you watching from? How have you been? And what's today? Tuesday. Okay, we're still very early on in the week, even though for me it feels like it's been it feels like as if it's midweek already. But anyway, seriously, I hope you guys are doing well. Thank you so much for joining. If you know me or if you've not met me before, I'm a GP based in the United Kingdom, and my interest is in women's health, sexual and reproductive health care, everything to do with that subject. And we're going to be talking in this channel about those related issues. It's called Ask Away Health for a reason, because I encourage you to ask questions from me, from your clinician, from your nurse, from your doctor, everybody who has a healthcare relationship with you, because you want to gather as much information to get yourself the best health possible. So let's get straight into today's business. But while I'm putting myself together, please give this video a like. I'm just checking to make sure that the audio is fine, so bear with me. Okay. Please give this video a like, and of course, if you find this information useful, do consider subscribing to the channel. Now, as usual, let me make sure I do not forget to include the disclaimer. Very important part of the conversation. I am not your registered practitioner, even though I love to talk to you, love to encourage and help you get on the right path towards the best health possible for yourself. So any information that we're talking about here is health information, health education. It is not specific medical treatment or advice for any one person, simply because I don't know your full medical history, and it would be irresponsible for me to try to provide advice about a situation like that when I don't have access to your full medical history. Okay, so let me just reshape that and make sure that you can see that properly. Sorry, that was out of focus for just a second. So disclaimer here, please let us keep that in mind. And without further ado, let us crack on with the very next segment. And you're looking at myths versus medicine. Yeah, it's our myths versus medicine segment. So like I said, we're talking about fallopian tube conditions, blocked fallopian tube mainly. There are different problems that can affect the fallopian tube. But yeah, I wanted to bring this up because I get it quite frequently on the channel. And I worry, sometimes I worry about it depending on the way it's phrased, because again, I don't have much information to back up as what the context is around whoever is asking the question. But essentially, it's around the belief that you can unblock fallopian tubes at home with herbs, supplements, or special cleansers. So you might have heard this, or you might be thinking about this, or perhaps you've even tried it, okay? And if you have tried it, let me know if you don't mind. Let us know. Yeah, let us know what your experience was like. It would be, just great to hear what, how successful it was for you. What did you use? How successful was it for you? Yeah, please do share with us what your experience is or was with regards to using any kind of treatments that were provided to you, or supplements meant for you to drink and then block your fallopian tubes at home. However, I want to say this categorically, it is a myth. It is not medicine. In fact, I would worry about this myth. I would consider it to be quite dangerous, because it can lead women along the path of a false hope, and perhaps spending plenty of money before they actually come to, and even spend time, precious time, might be ticking away while somebody is going down the route of a particular intervention that has no evidence of any success. The tubes are delicate, intricate structures. Pouring or drinking unproven substances, whether it's in the name of herbs or supplements or cleansers, that there's no evidence it works. Plus, it could cause infections and even make the situation worse. So please be careful. This is one myth I would like to happily dispel before we get started, because I get this fairly often in the channel, and I want to make sure that we're quite clear in our heads, so that we're not messing about with things that could make our situation worse. So drinking or pouring any herbs, supplements, cleansers, or anything with an aim of trying to unblock the fallopian tube. No, don't. It does not work. So please bear that in mind. Amazing, welcome back. Okay, so we're talking about fallopian tubes, and I thought it would be nice to get a little bit of background. I'm going to go into the questions in a second. Let me just share a couple of images that I think would be useful. I'm sorry, this is just going to block my face for a little bit, but just the fallopian tube. These are the two channels, or the two tubes that protrude from the body of the womb. As you can see from that image in the front, the body of the womb is in the middle, and you have two structures that protrude from its middle on either side, heading towards the ovary. So they're quite thin towards the body of the womb, and then they open up as they get near the ovary. And their main function, their main job really is they're a channel. They're a channel for the eggs to move from the ovary, where they are produced at ovulation, into the tube and towards the body of the womb, and for the sperm to travel from within the womb towards the egg, where they are fertilized. Actually, majority of the time when fertilization happens, it happens inside the womb. It is, sorry, inside the tube. It is happening inside the tube before the fertilized egg now travels down into the body of the womb, where it then gets implanted. That's generally what happens. Okay, but we have a lot of scenarios where the tube is blocked. There could be different reasons for this. Most commonly is following infection, and commonly sexually transmitted infections that can lead to something called pelvic inflammatory disease. I have a lot of videos on the channel about this. If you want to learn more, please check out my playlist. Could happen as a result of conditions like fibroids or endometriosis, depending on where the lesions or the fibroids are located. They could cause blockage, they could kink the tube. So different things can lead to trouble with the fallopian tube. Somebody, for example, who's had an ectopic pregnancy in the past, you can have medical treatments or surgical treatment. If there's been medical treatment and a complication of that may, or even surgical treatment, a complication of which could lead to scarring of the tube, that can lead to blockage of the tube going down the line. So if somebody's wondering what does a blocked fallopian tube look like, let me show you another graphic on my screen. So you can see that structure, and you can see the insert, the big yellow circle that shows you what the kind of blockage looks, what a blockage could look like. So just to have that in mind, that is what we're dealing with. There is another type of blockage. Let me share that with you as well, which many of you might have heard about. So this is called hysterosalpingogram. Let me know if that rings a bell, if your doctor, if anybody has mentioned it to you in the past. They're talking about fluid inside the tube. So I'm just trying to move this so that you can see this properly. Give me 2 seconds. Okay, so they're talking about a tube that's blocked with fluid, or blocked by fluid, and that has two implications. I'm going to talk about this a bit later, but just keep in mind this picture, and I think I'll bring it up when we're discussing that particular question in a second. Okay, so let's get cracking with the questions that we have today. And let me know if you've got any thoughts, any questions on this subject. It would be great to hear from you. I shall be back in 2 seconds. I'm enjoying that music. Okay, so thank you so much for liking the video. Low sound, somebody says low sound. Thank you for letting me know. Let me see. Let me know if it's better. I hope it's better. Please let me know. Thank you so much. Look inside you. That's useful feedback. Please let me know if the sound is any better. Is it my sound? Is it my voice? Or is it the rest of the audio that I'm testing? Let me know, please. I did set it so that, or can you not hear me at all? Because that's the other suggestion. But when I tested it, I was audible. Okay, so maybe I am audible, but maybe it's the volume. Okay, I will work on the volume, but thank you so much for that feedback. Okay, so guys, let us go into the deep dive. So deep dive is you're looking at specific questions that have come into the my channel. You know, people have posted in. I've got a question here from Manav who says cause of blockage here on YouTube. Manav, I just went through a list, but just to quickly, just in case you missed that. So we talked about things like infections, most commonly sexually transmitted infections. I mentioned things like conditions like fibroids, endometriosis, even an ectopic pregnancy. There are quite a few things that can cause blockage. Even more recently, we're learning that there could be some types of cancer that might even start within the fallopian tube before spreading or moving towards the ovary. So there are quite a few things, but if we're looking at the more common causes that we see from day to day in practice at the moment, then we're thinking about things like infections, we're thinking about things like fibroids, we're thinking about things like endometriosis and so on. So let me know your thoughts. Okay, so let's get into the questions. So the first one had something to do with understanding HSG, and then a worry about IVF only or IVF as the only option. So there are a number of questions. I'm not going to go through all of them. One of them said, I have done HSG, both tubes are blocked. What can I do? Help me. The doctor said both tubes are blocked. The only option of having a baby is IVF. I just did my HSG. I found that I have 2 blocked tubes. So questions around that area. What is an HSG? Those 3 letters stand for the word hysterosalpingogram. It's just one of the tests that we can use to check if the tubes are open. That's basically what it is. It's an X-ray. It's like when they say go and do a chest X-ray, for example. So it's taking a snapshot of your womb and the tubes. But the special thing about it is, while the film is being taken, they're going to be passing some dye through the vagina into the womb. Now the expectation is that if the tubes are open, that dye is going to spill out of the open tubes, because the tubes are like a channel. I mean, if you just look at this that I've got up here now, if you've got an open tube and you pass fluid through it, it's supposed to pass through, and so it should spill out of this end if you assume that this bit is the womb. Okay, so the HSG is just a test that we do to check whether the tubes are open. Okay, so for some women, it's a bit uncomfortable. It is, yes, it can be a bit uncomfortable, of course. For a normal HSG, I thought I had pictures, but I don't have any pictures here. For a normal HSG, you will see the dye as you take a series of films or pictures. You will see the dye as it flushes or spills out of the tubes and into the rest of the pelvis. We actually see it, okay? And if we don't see that spill, that is what suggests a blockage. Now, the thing about where you have your HSG and they say, oh, both tubes are blocked, only IVF, it looks like it's a, at the end of the story, it looks like a final conclusion of things. But like I said, HSG is just one of those tests that looks at whether the tube is open or whether the tubes are open or not. So while it can show that there is a blockage, it doesn't tell us the type of blockage, and there are different types of blockage that can happen with the tube. So the first is one that is quite close to the womb itself, and it's called a proximal blockage. Now, this can sometimes be caused by little plugs of tissue or mucus. Just imagine if you have a blocked nose, and I'm sorry to sound really disgusting at this time of the day, but yeah, something similar. If you have a plug of mucus blocking the nostril, something similar to that can happen in the tube. So it could be that is what is causing the obstruction, preventing sperm and egg from traveling as they should. Sometimes, if it's a straightforward, sort of fairly uncomplicated blockage like that, the HSG itself, by reason of trying to push this dye through the tubes, could dislodge or remove the blockage, and actually find that after the process, or as the process is going on, the tubes open up again. Sometimes that can happen. Other times when that blockage is not because of mucus that can easily be shifted, it means that you might need to have surgery that's called tubal recannulation. So what that means is that the tube itself is blocked. There's a gap, there's a section of the tube that's blocked, and they want to sort of pass a probe or instrument through to try and open up the tube. That's very delicate surgery. Let me just go back to that picture I was sharing with you guys earlier. so that you can see what I mean. So we're looking at the blocked picture. Give me a second so I can pull that up for you. So we're looking at, hang on, let me just bring this down so you can see clearly. Yeah, so we're looking at, if you look at that section where there's a blockage, so thinking about surgery that's actually going to dislodge, remove the debris or remove those scars or whatever within that tiny channel that's causing the blockage. So just keep that in mind. So that doesn't automatically equal having IVF. It's a procedure where the treatment is specifically targeted towards trying to open up that tube. Everything else might be working fine. Ovaries are working fine, so you're ovulating okay. No issues within the womb itself. Partner is fine. So it may be as straightforward as that and no need for surgery. So the point I'm trying to make with that is that when they say, from the HSG that the tubes are blocked, doesn't mean that automatically signals IVF. It means that, okay, the next question is what is causing, or what type of blockage, or what is causing the blockage in this particular instance. So we talked about proximal blockage, where the blockage is near the body of the womb itself, and it could be because of mucus, like I said earlier, it could be because of scars or debris. But there's another type which commonly happens towards the later end of the tube. This is called distal blockage, and you commonly see it is commonly known as hydrosalpinx. So it's at the far end of the tube. That is the end that is closer to the ovaries, where and that's the first part of the tube that the egg will approach or will reach when it is when ovulation happens. So in this case, and let me bring that picture that I showed you earlier. In this case, what we're dealing with is a situation where there is fluid inside. Move that up for you. Yeah, so you've got fluid inside. So if you look at the image very, very carefully, right, you will see on one side you have a nice sort of, nice shaped tube that looks pretty much like what I was showing, the cable I showed you, got a little bit of bend, a little bit of movement, a healthy looking tube compared to the other side where it looks big, it looks swollen, it looks like nothing can get through it, basically. Okay, so that's the point I'm trying to get to. So this is blocked by fluid, and there are two issues here, right? The first is that because the tissues are distorted, the tissues are misshapen, the tissues are swollen, so the tube itself is closed shut. It's difficult for the egg and the sperm to conduct their journey towards each other to fertilize. The other problem as well is that you could have the nature of this fluid is toxic. It's not just that the fluid, the water or fluid, whatever you want to call it, within the tube is causing the blockage, but that fluid itself is also toxic to any embryo. So assuming the other tube is fine, and I think this is really important, one of the findings that we have in terms of fallopian tube medicine. Assuming the other tube is fine, there's still some women who have one good tube, but the other tube is hydrosalpinx and have problems with pregnancy. Perhaps they have miscarriage or even trouble getting pregnant. And one of the thinking behind that is that the toxic fluid, and when I say toxic, I mean it's poisonous. So that toxic fluid is creating a problem so that an embryo that is produced from the other good tube can't even survive because that toxic fluid from the opposite tube that's damaged is creating an unhealthy environment. And so what they would usually do in that instance is clip off that tube, even remove it. It's more complicated to treat, but they might clip it up or remove it so that the one good tube that is doing the job has a good enough chance to provide people with a good chance of pregnancy. So if there is blockage of both tubes, yes, IVF is often the most effective and recommended treatment, especially if we're dealing with the hydrosalpinx scenario, that is the fluid in the tube situation I've just described. But it's not the only choice. The important thing is that each person should have a discussion with their practitioner to understand what is the type of blockage, and the fact that IVF is an effective treatment, even compared to surgery on the tubes, shouldn't take surgery on the tubes completely off the table. It's an option. It's an option. We acknowledge that IVF, if you go down that route, is probably surgical research has shown that it is more effective. But for some people who want to give it a try, it's a conversation. It's a conversation to have. Okay, so I would recommend for those people who are having that conversation, the tone of the messages is quite distressing. HSG, tubes blocked, IVF. Please calm down. Please have a conversation with your doctor. And they'll be in a better position. That is your surgeon, your reproductive endocrinologist or your fertility specialist. They will be in a better position to advise you about what options are best, including IVF. And don't let's get it right. IVF is probably the best option for you, given the high success rates when it comes to blockage on both sides. But I'm not going to say that you can consider the other options, because we all have different situations and different scenarios. Okay, friends, let us take a quick break. We've tackled one set of questions. Let's take a quick break. And when we come back, we're going to get into, what are we going to get into? We're going to get into the next aspect of our conversation. I'll just be back in a few seconds. Okay, welcome back. So thank you so much. If you're just joining the stream, we're looking at fallopian tube questions. Many questions come into the channel on a regular basis. We've just covered our first two segments for the show today. We looked at one of the popular myths around taking cleansers or juices or supplements to treat fallopian tube blockage at home. I've said absolutely not. Absolutely not. There is no evidence that works. It can also be counterproductive in addition to that, because it could lead to infection. It could lead to lots of expenses and resources being spent on a treatment that's not going to work. It can lead to delays in going after a particular thing that's not going to work while time is ticking. And when it comes to fertility and conception, you know that time is essential. Okay, then we looked at a question, or we looked at a series of questions where ladies are worried about blockage of tubes on both sides, which has been diagnosed by the HSG, and they're just faced with the only option of IVF. And I've explained that while IVF is the most effective treatment option, it's not the only one, depending on the type of blockage. And I encouraged a really detailed conversation with your doctor, so that your fertility specialist, so that depending on your own specific scenario, they can look at what is the best treatment for you. So let us hop along to the next deep dives that we're having in this particular stream. And this is around ectopic pregnancy and unexplained tube issues. So let me read out the question. This person says she's had 2 ectopic pregnancies, and then she had an HSG done. It showed that her tubes were clear. However, she still had ectopic pregnancy. She never had a PID, that's a pelvic inflammatory disease. She never had a sexually transmitted infection, and she's going to do surgery to check her tube. So, of course, my heart goes out to you. Thank you for sending in the question, because I think it's a very important point that's been made here. The HSG I've explained what the HSG does. It's one of those tests that tells us whether the tubes are open or not. So the HSG has demonstrated to us that the tubes are open. But I think this question also shows that it can have certain limitations, right? Because that the tube is open means that dye is passing through the tube. Fine, okay. But what about the inner structure of the tube? What about the inner material or the inner yeah, the structure is the best word, because inside the tube are little like hair-like structures. We call them cilia, but they're like little hair-like structures, like hair. If you know, around your nostril there's a little bit of hair, so it's something similar to that we have in the tube. And the reason they are there is that they help to gently waft the egg along its way, helping as they move, as those cilia move back and forth, they're creating a stream that directs the egg along its way down the tube into the womb or towards the sperm. So if those structures are damaged, it's not going to be picked up on an HSG. Okay, so the embryo, if those structures are damaged, the embryo or the egg can get stuck. It can implant in the tube, leading to or causing an ectopic pregnancy. So that kind of damage may not always be from a known infection. So what I'm trying to say is that even though the HSG has shown that there's no problem with the tube, there may be some microscopic damage that is not readily obvious on the HSG that can make having an ectopic pregnancy likely. So which kind of scenarios would that be? Because after all, if you have a PID, given the way that we describe PID, of course you would know about it, because PID, there's a lot of pain, fever, abnormal discharge, vaginal discharge, abnormal bleeding, and so on. It's a really serious medical condition that can land people in hospital in its very severe cases if it's not treated properly. So if there's a subclinical infection, so may not be so serious as that, but it can cause damage to the tissues. So the symptoms were mild, you didn't really notice anything had gone wrong. Or if there's endometriosis lesions can develop anywhere in the body, plus in the tube, around the tube. If there is tissue like that, it can lead to inflammation and scarring. Or there might be issues, previous surgery or scars that have caused changes inside the pelvic wall that might cause the tube to kink or to not function normally. So what is the next step? The next step, which what she's mentioned in her question, is having a laparoscopy, because now they can have a close look at the area around the tube. Okay, like I said, HSG is just one of a number of different tests that you can do to check whether the tube is open or not. You can also do a laparoscopy, which is a camera test that looks into the pelvis, looks into and directly at the organs. So you're looking at the womb itself, the outside of the womb, you're looking at the bladder, you're looking at the tissues around to see, is there any abnormality that could be affecting both the outside environment of the tube and could affect the inner environment of the tube. So basically just trying to see if there are things that the HSG could not detect. So I hope that helps. I hope that helps to clarify. And I completely agree with your next step that you've mentioned in terms of having the laparoscopy. All right, guys, thank you so much. I think we're done with that question. Thank you so much for watching. Let me just have a quick look on the chat to see what's happening. If you're watching, guys, please let me know where you're watching from. That would be really great. I can see we've got a couple of people on here. Don't forget to give the video a like. That would be much appreciated. And I've got a couple of questions here. Let me see where we are. What are we doing for time? Okay, I've got to be off shortly. Okay, somebody says, what are my options in family planning if I have reactions to hormonal family planning? That is a very good question. Of course, at the moment, there are so many different family planning, birth control or contraception options. I don't know all your medical background, so we're just going to talk generally. But of course, I'll direct you to go to your health provider to sit down and have a look at the different options to use. Now, the copper coil or the copper IUD is not a hormonal method. So depending on your preference and your choice, you could go and sit down with your practitioner to have a look at what that looks like, how it would fit into your lifestyle, and how it would work for you. So that's something that you could consider. Of course, there are the other methods, the so-called natural methods, where you're looking at counting the calendar, trying to work out what your cervical mucus is telling you about your stage in the cycle, so that you're avoiding sex during the times when you're most fertile, and using that to try and map out a period that is safe. So that is another one. Your fertility awareness method is another one that is, of course, is non-hormonal method. There are a few other relatively newer options, not so popular. I don't know which part of the world you're watching from, not so popular. There's one that comes to mind. I did a deep dive video into it perhaps a year ago or so. I think it's definitely released in America, probably in Australia, but again, it depends on where you're watching from. But you can have a conversation with your doctor because there are options. The important thing is not to give up. And the beauty about different contraception methods is, catering for a whole different group of people because we're all different, have different medical backgrounds. So I hope that helps, Nicole Kunte. Thank you so much for putting that question. If you're still here, let me know where you're watching from. Let me know if you have any further thoughts on that. Let's take one more question before we go on a break. I'm not sure what this question is relating to. So, because it doesn't refer to anything around birth control. Wait, hang on. How many generations? Okay, let's read this out because maybe you guys in the chat will have something to say about this. If we are what we eat and we eat GMO, non-seeded food grown off another root. Oh, wow, this one is something I have to look into. How many generations will it take that people won't be able to make a baby natural, in vitro only society? Tanya, you seem to have a very strong opinion about this. I'm not sure where all your evidence for these postulations are. Please let us know if you have any further information or any resources that you could put on the chat for where we could read up this information. It's not an in vitro only society. In vitro fertilization has been a blessing to many families who otherwise wouldn't have been able to have children. So I see it as an advance of technology. I see it as an advance of medical knowledge that has provided some good in a world where sometimes our scientific discoveries provide not very good outcomes. So Tanya says, just wondering. Yeah. Oh, Nicole, sorry, Nicole, I missed yours. Thank you, Dr. Motlo from Kenya. Amazing, amazing. Okay. Thank you so much for watching. And Tanya says you're just wondering. I think it's an interesting concept. And I thought you had some resources that indicated that fertility is related to the types of food that we eat. And don't get me wrong, of course, the point that you're making about we are what we eat is a very, very valid point. Because the type of food, our diet, or even lifestyle generally, of course, is a key determinant of our health. So I totally accept that. It's just trying to correlate that with increasing fertility. There are so many other factors associated with infertility in our times in this century. But I definitely agree that a lot of our diet, a lot of lifestyle things that we do or not do can contribute to it. Absolutely. You're welcome, Tanya. So you're watching from USA, Washington, D.C. Thank you so much for joining. Okay, so let me take one more question. This is from Anu. Hi, Anu. Where are you watching from? Thank you for posting your question. You said, what will be the options or next steps if I have endometriosis adhesions between the womb and the bowel, between the uterus and the bowel? Tubes are blocked. Both ovaries are bulky and partially adhered to the true pelvis side walls. So I think with this scan report, I want to believe that you are under the care of a fertility specialist, and having a conversation with them is really important, because when you think about the pregnancy process, or when you think about the conception process and how you need healthy ovaries plus healthy womb plus healthy tubes, there are a few things here that you're describing that indicate that there are challenges in those areas. For example, blocked tubes, bulky ovaries, and you're saying they're partially stuck to the pelvis, and then endometriosis between the womb and the bowel. So I can't even begin to imagine what kind of symptoms that you're going through. And, I really feel for this kind of picture, because it's obviously must be very difficult, not just the experience of the symptoms. I don't know how old you are. I don't know what other medical issues or symptoms or problems that you might have. But yes, of course, your doctors will be looking at alternative conception methods. They'll be having that conversation with you. So it may be depending on how severe these conditions are, because, you know, sort of reading the face of it, you could suggest that these are moderate to severe levels of the disease that could lead to fertility. So it may be that they will be discussing with you alternative fertilization methods. And I think it's worth having a conversation to see which one is suitable, which one you feel most able to deal with. If your doctors feel that there are any medical treatments, that is non-surgical treatments, that can help with the ovaries, for example, or with your endometriosis, that is a conversation to have with them as well. So I can't tell you specifically go for this or go for that. I think it is important to sit down and speak to your doctor to have a very good discussion around it. And I do encourage you to do so. Please don't give up. I think having a very practical conversation with them, having a very realistic, let us put all the cards on the table. What are my options? And it might be good to get a second opinion if you hear from one person. If it's something you're able to do, a second opinion may also be useful, so that you can make what I think will be really important life-impacting decisions. You can make them knowing that you've got all the best advice available. But I would say that if there is extensive disease affecting ovaries, affecting tubes, affecting womb, and endometriosis environment that can also, because of the inflammation, that can also affect pregnancy, I would say that they probably will be looking at alternative to natural fertilization. So assisted birth is what I'm saying, but it depends on the degree, depends on all your other medical history or medical conditions, if you have any, your age, and so on. So many factors play into that as well. Okay, guys, thank you so much. Really great questions. I appreciate your input. I appreciate your engagement. Let us go on to the next part of our show today. Let me see. Let me just cue this up for you. I'll take a quick break actually before I do that, and I'll come back to you in a second. So as a result of conditions like fibroids or endometriosis, depending on where the lesions or the fibroids are located, they could cause blockage, they could kink the tube. So different things can lead to trouble with the fallopian tube. Somebody, for example, who's had an ectopic pregnancy in the past, you can have medical treatment or surgical treatment. If there's been medical treatment and a complication of that may, or even surgical treatment, a complication of which could lead to scarring of the tube, that can lead to blockage of the tube going down the line. So if somebody's wondering what is a blocked fallopian tube, I'm going to show you another graphic on that. Excellent. Okay, thank you so much, guys. Thank you for sticking with me. So we are continuing the deep dive, and so we're looking at another bundle of questions, and this is around one blocked tube. So we dealt with 2 blocked tubes, 1 blocked tube, and people are generally asking, the worry is, can I still get pregnant if I have 1 blocked tube? Because it does, getting that diagnosis can create such anxiety. So I want to say the very short answer is yes, you can absolutely get pregnant with 1 open tube. Okay, the ovary on the side of the open tube is still going to ovulate. The egg, the egg can actually be picked up by the opposite tube. In fact, there's some evidence that the tubes can communicate and sometimes even pick up an egg from the opposite ovary. But the point I'm trying to make is, you might feel as if, oh, my fertility chances or my fertility potential is cut in half, but actually that's not the case. Many women have successful pregnancies with one functioning tube. If you were here at the beginning where I was talking about the hydrosalpinx and trying to explain about the fluid in the tube and saying that the problem with the hydrosalpinx is not just fluid blocking the tube, causing the tissues to swell and blocking the tube, it's also the nature of the fluid, that it contains toxic or poisonous material, or material that is not friendly to a thriving egg or embryo if fertilization has happened. So that generally, if there's a disease or damage to one tube, your doctors will probably be looking at what will happen to that tube. Is it healthy or safe to leave it in place if it's not a hydrosalpinx? If it's a hydrosalpinx where there's fluid in it, then they might be thinking of clipping off that tube so it's not passing or it's not leaking any of that harmful toxic fluid into the rest of the womb or into the rest of the pelvis to create any problems for conception. But to cut a very, very long story short, if you have a healthy open tube, you're still ovulating. You have a tube that's still ovulating on both ovaries. You have a tube that's able to pick up an egg if the egg comes from the tube opposite to the healthy one, it can pick it up. If it comes from the ovary that is beside the healthy tube, it can pick up. So there is still a possibility of getting pregnant. It's not diminished. The important things are to keep doing what you're doing to stay healthy, avoid stress, eating well, resting well, taking your prenatal vitamins or supplements as recommended by your doctor, being under the care of a fertility specialist, and making sure that you're having that frame of mind that yes, it is possible, and congratulations in advance. Okay, so the very next question, and this is a mixed bag of different things. Somebody's talking about hydrosalpinx and having their tubes tied. So somebody says, I have hydrosalpinx, both tubes diagnosed in 2017. So that means that situation I've just described of fluid in the tube happening on both sides. And then somebody else says, my tubes were tied back in 2013. Since then, wanting a rainbow baby. And I don't know when it's going to happen, is what she says. And then somebody's asking about a tubal ligation. Okay, let's talk about this. So hydrosalpinx, you guys know about it. I've described it. It's a form of tube blockage. The fluid inside the tubes can be toxic, inflammatory to embryos. And so what usually will be your specialist will be thinking about doing is removing that tube to reduce any chances that it might impact or affect the success of any pregnancy, whether it's natural with a good working tube or whether it's via IVF. So that's the hydrosalpinx. If it's affected both tubes, they're going to do surgery, either clip off the tubes or remove the tubes, and then IVF would be the treatment. We've already said at the beginning that IVF is the most effective treatment, especially looking at the medical information that you're providing. So now with tubal ligation reversal. Tubal ligation is tubal tying or tubal cutting or tubal clipping. We're basically saying that we're blocking the tube, we're interrupting the flow of the tubes. We're saying that if we have the tube like this, we're doing a snip or we're doing a tie or we're doing a clip, okay, so that it's not going to work, so no egg or sperm can pass through. That's what we're trying to say. So that is a different scenario from a disease-based blockage, okay? Because here the tubes is a surgical process that we use to cut or to tie or to clip to prevent pregnancy. And so the options for pregnancy at that stage would be reversing the tie, reversing the ligation, or IVF. Now, how successful? I'm not saying ligation reversal is not possible. It's very possible. How successful it is depends on a number of things. Okay, it depends on how old you are, or the chance of getting pregnant after the ligation is reversed will depend on your age when it's reversed. Depends on the amount of healthy tube, because remember that with any surgical process, even with the most skilled practitioner, even in the absence of any complications, there will still be some degree of scarring that will develop. Okay, so even with that, there could be, the question will depend on how much healthy tube is left on that side. So it's something that needs to be considered. But I think that many specialists will be talking about IVF, again, depending on your specific circumstances. So you'd have to have that conversation, because the choice is between reversing the tube tie or clip or cut, and having IVF, just completely bypassing the tube and having IVF. It will depend on you, your own doctor's specific recommendation, and what they think will be the best way forward for you to do so. Okay, so Anne is watching. Hey, Anne, you're from London. Oh my goodness, amazing. I'm so glad that you caught the live. Thank you so much for watching. And yeah, please guys, please like the video. That would really be appreciated. Okay, let me know what you guys think. I hope you're finding this useful. Let us just take a quick break, and then we're going to carry on with the rest of the show. Okay. Welcome back. So we are doing a deep dive. We are looking at questions that have come into the channel around fallopian tube blockage, and we are just tackling them. It's been a long while since I addressed the topic, actually, so those questions, they've been piling up for me. So thank you so much. If you have watched any of my videos in the past and you popped a question in the chat, I do try to get to them one way or the other, either answering directly or trying to put everything together in a video like this when there's really not much time to do that. Okay, so let's go through the next batch of questions. Somebody says, do you feel pain when your fallopian tubes are blocked? Wow, good question. Oh, and this is one, I think I've already covered this one. Somebody says, can you unblock tubes at home? But I would like to put a disclaimer, because the person that posted that has comedian in their names. I don't know whether they're just trying to pull our legs. And then somebody else says, what is the job of Clomid? What is the job of Clomid when it comes to your fallopian tubes? Guys, let me know what you think, if you have any thoughts, if you have any experience around this. But let's tackle the questions one after the other. So pain, having a blocked tube in itself wouldn't cause pain. So it wouldn't really give you any specific pain in your tummy or in your pelvis that will make you think, am I having pain because of a blocked tube? But remember, at the beginning we said there are a few things that can cause the blockage. So something like fibroids or endometriosis, right? If a fibroid is located in such a way that it is stretching the womb itself and pushing the womb, making it bigger, pushing it towards the ovary, pushing it towards the tube, that could kink the tube or even press the tube against the rest of the pelvic wall, and that could cause pain. And it's not because the tube is blocked, but the pain is not coming because the tube is blocked. It's the fibroid that's causing the blockage, or if there's endometriosis causing that problem, or well, something like a hydrosalpinx can cause chronic pelvic pain. So there, yeah, it will depend on the cause. The tube itself, the blockage itself, tends to be silent, and so you don't realize. That's why it comes as a surprise. You don't realize what's going on until it's in the whole process of trying to work out what about your fertility, doing fertility assessment, and then it is detected during those series of investigations or tests. Okay, so unblocking the tubes at home, we've said absolutely no. There is no safe way that you can take a tablet or a pill or a cleanser or a juicer or whatever to unblock the tubes at home. You need proper medical assessment, diagnosis, determine exactly what is the problem, proximal or distal. Then what is the treatment option? There is no juice or cleanser that's going to make the difference. Okay, and then somebody said about Clomid. Clomid is a tablet that we give to induce ovulation, so to induce the release of mature eggs from the ovary. So this is a drug that is stimulating parts of the brain to influence the ovaries to process the development and release of eggs. It is not a fallopian tube medicine. It doesn't unblock the fallopian tube. So please don't go away thinking, oh, if I take Clomid, I'm going to unblock my tube. No. If the tubes are blocked, the egg and the sperm cannot meet. Remember I said that the position or the location in the body where fertilization is most likely to happen is within the tube, and then it's a fertilized egg that then swims down into the womb to get implanted. So if you take Clomid, if you're ovulating okay and you take Clomid, you're not making any difference to yourself. Clomid is in the situation where we find a woman is not ovulating. That's when, or ovulating regularly, that's when Clomid will be of value to the woman or to the person who's taking it. Okay, excellent batch of questions that we've had today. Thank you so much for joining. Thank you so much to everybody who's put in a question or a comment on the stream today. It was just meant to be a very quick one because I wanted to get myself more familiar with my new streaming platform, and I'm going to keep practicing. I hope I'll be able to do a bit more, maybe a few more streams or more frequent streams, so I'm a bit more hands-on with switching from one screen to the other, but I think I'm getting there. So guys, thank you so much for watching. Please give this video a like. Don't forget to keep sending the questions in. If you're based in the United Kingdom, then yourgpconsultation.com is the place to be, because there I can sit down with you half an hour, 45 minutes, depending on what your needs are. Women's health, sexual and reproductive healthcare issues. So please visit our site, book an appointment. For everyone else, use the free resources we have on Ask Away Health. Use this opportunity. While I don't provide you specific medical advice, I'm happy to sort of signpost, provide education, break down any jargon or any confusion around any particular issues. That is what we're here for. Thank you so much for watching. Great to be on here with you, and I will see you again real soon. Take care, guys. Bye.